2:36.
2:30.
What time's your appointment?
3:10.
Have you checked in, though? Yeah. Is it Andrew Robinson? Yeah. She's just seeing the 2 patients now, and then you should be seen. So hopefully it's not too long. OK?
Mohammed Awan, please. Hi. Sorry about the wait. Yeah, I'm all right, thank you. We've come to talk about your asthma?
Asthma, yeah.
Great.
That's right, yeah.
Pop on the scales for me, please.
Okay. Get my shoes on. Yeah.
Okay, yeah. So we'll call that...
88.
We'll call that 86.
Seven,
We'll call that
yeah.
86 because you've got your shoes on.
Shoes on.
Right. So the other thing we'll do while you're standing up
Uh-huh.
is... Do you remember how to do this peak flow?
Yeah.
Yeah? So hard and fast flow, please.
No problem.
Oh, my goodness me, that's good.
Was it?
570. Do one more.
No.
Fab. Thank you. 590. So take a seat. Did you have a letter to come?
No, I didn't have a letter, actually. I've got... My asthma got worse, actually.
OK.
I had flu 8 weeks ago.
OK.
And once the flu was over,
Yes.
I started like getting irritation in my airways. Felt like there's something like, you know, I need to cough out.
Okay.
When I take inhaler, that goes away.
OK. Have you brought your inhalers with you?
Yeah, I bought the blue inhaler.
Yeah. Can you just show me your technique, please?
My technique is good.
Just talk me through how you use it.
So basically, for example, I'll shake it.
Yeah.
Put it here.
Attach it.
Breathe out.
Yeah.
And then as soon as I basically press this,
Yes.
I breathe in and
Okay.
hold my breath for
Yeah.
5 to 10 seconds.
OK, and then do you take a few breaths out of that?
Couple of breaths I take, yeah.
Good.
Out of that, yeah.
And then for the second puff, because it's always 2 puffs, you would shake
Yeah,
it again,
yeah,
yeah? Because
again.
it needs to mix.
Yeah, that's
Great.
right, yeah.
Let's just check your date on that. That's expired.
That has it. Ah,
That expired last year.
has it.
Yeah. OK, so we need to do something about
No, actually,
that.
I haven't used that. It was in my car.
This isn't going to work because
Yeah,
it's
no, this
ever
won't
so
work.
out of date.
No, but I've been taking that blue inhaler.
OK.
So I have to take it quite often. Because
Hang on,
it-
you just said you've been taking the blue. This is the blue one.
Yeah, yeah, yeah. No, I've got other blue at home as well.
Oh,
The-
OK.
yeah,
And
yeah,
how
in
long have
date.
you had those at home?
No, they are in date.
We often come across patients who are taking expired inhalers. They attend the surgery because the inhalers are not working, and when we look at the date on the inhaler, it has expired. All drugs have an expiry date on the container. This is also written in Braille for the visually impaired patient. If taken after the expiry date, this medicine will be ineffective, will not treat the problem, and may be damaging to your health. Can I make a suggestion? Can we try a different inhaler?
Yeah, yeah.
So we've got this one. OK, it's called Spiromax. OK, and this one is a powder, a dry powder inhaler.
Oh, okay.
And the way, it's got a big dose counter on the back so you can see how much is left. And basically all you have to do is open it and it clicks.
Oh,
When
okay.
it clicks, it's ready.
Ready, okay. So
Okay.
that means it's ready.
Empty your lungs.
And just do it like that. Oh,
OK? It's 1 to 2 puffs, twice a day.
okay. No.
Shall I throw this one?
Yeah, please. Thanks for telling me. I didn't. Yeah.
That's okay.
Cool. Normally I check the dates and stuff. I don't
That's
know.
fine.
how-
OK.
Yeah.
OK, anything else I can do for you?
No, that's
Lovely.
Thank you very
OK,
much.
I've just got to go and get that signed.
Signed,
If you take
I'll
a seat in the waiting
okay.
room.
Okay, no problem.
OK then.
Thank you very much.
You're very welcome. Thank you.
Won't be long, will it?
No, you'll be all right.
My appointment was 3:10.
Who are you seeing?
I don't know.
Andrew. So she'll call you. You're next.
Next.
Yeah.
All right.
All right?
I'm just going to pop
Gave that
outside
to the
for a second.
pharmacy.
Samantha Dodds, please.
Thank you.
That's OK. Come on in. Nice to see you, Samantha.
Thank you. Hello.
Can I help today?
We had a thyroid test done last week.
Yeah.
It was sort of regarding my sweating. I'm still having problems sweating, but I don't know if it shows anything at all.
Yeah. Let's have a look. Samantha's been troubled by quite
severe chronic abdominal pain for several years now, and it was recently suggested that this could be due to an issue we call sphincter of Oddi dysfunction. The sphincter of Oddi is a valve which is designed to control the flow of digestive juices into our bowels, and if that isn't working properly, it goes into spasm, and that can lead to quite severe abdominal discomfort.
Your thyroid blood test has come back completely normal.
Oh, good.
So that's good.
What do you think the sweating could be then? Because I was sort of hoping it was that would show up for the sweating, really.
Right,
'Cause even
okay.
though it's cold out there, I can't bear to put my coat on because I'll end up all hot and
Start
sticky.
yeah. How long has this been happening for?
It started back in July, and I just put it down to the heat at first.
Right,
And
okay.
it calmed down till about 2 weeks ago. And I don't know, because my pain's got a bit worse the last couple of weeks. I don't know if that's what's triggering it all over again.
Yeah. And do you think there are links with your pain?
When I'm bad, I do tend to get all hot and bothered.
Right. Have any new medications been started in the last few months?
I don't think anything new's been started. I've changed my antidepressant over. I don't know if it's linked to the amitriptyline because they put me up to 75 milligram of that. Because I was on it 50 milligram before. They don't know if that could be what's triggered it.
I just want to double check because I've got a sneaky feeling it may well be the amitriptyline.
Yeah.
Especially at that kind of dose.
Yeah.
That's quite a high dose.
Yeah. I wouldn't want to lower it because it's helped the pain tremendously, you know.
Okay. So, side effects. Let's have a look. Sweating.
Okay, so right there.
Possible.
Yeah.
It may well be that. I mean, it's got lots of potential for side effects.
Yeah.
There's one extra thing it says, actually. If amitriptyline causes side effects, it's worth persisting because sometimes the longer you're on the amitriptyline for, the side effects can settle and die down.
Every drug comes with an extensive list of side effects. This can seem quite scary for a patient because at first glance it may seem that the drug is going to do more harm than good for them. As doctors, we're on a daily basis making these kind of decisions with patients where you're discussing the potential benefits of that drug versus the side effects and coming to kind of share decisions with the patient.
I'd say give it perhaps another 2 to 4 weeks, and if it's still no better, do come back and have a chat with us.
Brilliant. Well, thank you very
You're
much.
welcome. OK.
Thank you.
Take care.
Thank you.
Cheers.
Cheers.
How can I help?
What's happened is with this patient, we ordered 5 of these medications on the 5th, and on the 9th, on our record, someone's written deceased, like as in he's passed away, but he's physically here in person. I don't know what's happened. Would you just be able to check what's happening with that, please?
Just saying that.
On yours as well? I don't know who's passed that information on because he's like, alive and kicking.
How can I help today, Andrew?
I've got the runs.
So you've got diarrhea?
Yes.
How many days?
2 or 3 days. I get it quite frequently.
When did you have it last?
A couple of months ago.
Okay. Is there any blood in the poo at all? No?
No.
That's good. How much are you drinking? Because sometimes alcohol can cause...
No.
Any vomiting?
No.
Any sweats?
No.
Are you able to eat and drink okay?
Yes.
Let's do your temperature. Pop your hat above your... Where are you living at the moment? Still on the streets or...?
No.
Do you have a urine infection? Is it stinging and burning at the moment?
I do have a urine infection, I think, yes.
At the moment?
Yes.
How long has it been stinging and burning for? Pop your head to the side.
A couple of days.
You have got a mild temperature. Pop your jacket off.
Yeah.
Sit on this seat, actually, Andrew. Is that OK, so we can do your blood pressure?
Yes.
Andrew, it's very important. If this diarrhoea carries on, or there's any blood, or it doesn't stop
No, I
off...
just get it quite frequently.
But if it doesn't stop...
Yes, I've heard that.
Perfect. No, but we have to let you know. I can see that you've been going to A&E recently and someone found you in the street intoxicated. What happened?
Yes. I don't know.
How much would you say you drink a day now?
Quarter bottle of whiskey or vodka.
Do you also eat regularly, though, to absorb the alcohol?
Yes.
That's good. I think what we need to do, Andrew, is give you something called Diarrhea. Have you had that before?
No.
It's like a sugar and a salt solution, OK?
Yes.
And what I need you to do is mix it with a glass of tap water.
Yes.
Try to spread it over 1 or 2 hours each glass, yeah?
Yes.
So try
Can
to
we
have...
get on with it?
Yeah. I've got to explain this to you, though, Andrew, OK?
Yes, OK.
No, if you let me finish, because that's why you've come in for our advice. Hop on this couch for me.
What for?
I need to feel your tummy. Is that OK?
Yes.
That's it. Lie back for me, lovely. Pull up your jumper so I can feel your belly. And the other top bit.
Yes, okay.
Perfect. Ready? Okay.
Hurts.
Which part does it hurt in? Can you point to the area? In the middle?
Yeah.
Okay, that's fine.
Bye.
We'll give you some antibiotics for the wee. You've got to drink a lot of fluids, okay?
Yes, okay.
Otherwise,
Yes.
I don't want you to get angry, Andrew, but you've got to let me finish speaking.
I understand what you say.
I know, but I'm...
When you say it once.
We know that some patients don't always retain the information and the take-home messages within a consultation. And therefore, for their safety, it's really important as a GP that I reiterate some of those take-home messages, and that's what I was trying to get across for Andrew. I want you to start the antibiotics today. Are you allergic to any antibiotics?
No.
OK. Do you smoke as well, Andrew?
I do.
And how many do you smoke a day?
40.
40. Finally, let's pop your oxygen. Pop your finger out so we can do your oxygen. That's it. That's the one. That's good, that's normal. Brilliant. That's the Diarrhea, black currant flavour. 1 sachet after each loose poo, or have at least 2 or 3 a day. If you're still having loose stools despite a couple of days of this, you need to either come and see us or go straight to A&E.
Right.
OK? Because you might need some fluids in a drip. Especially if you're having whiskey on top, it makes you very dehydrated. Yes. With certain patients, if we are worried as a GP about their safety and welfare, ourselves as GPs have got the power to refer them to the social services department. But if the patient has got the capacity to decline this offer, then unfortunately we can be left in a tricky situation. For the urine infection, that's a tablet. Take it twice a day for the...
What's that for?
That's the antibiotic for the urine.
The tablet?
Yeah, the tablet is an antibiotic for the urine infection, OK?
Yes, all right.
1 tablet twice a day, OK? For 5 days, OK? Take care, Andrew.
Thank you.
OK? Take care.